Hello everybody, my name is Dr. Rob Conroy from Inspire Chiropractic and Wellness Studio, and welcome to Dr. Rob's Spinal Tip of the Week. This is where I get to share with you my best tips and strategies so that you can start living better and feeling better now. This month's topic is low back pain and stiffness. Hey everybody, it's Dr. Rob here from Inspire Chiropractic and Wellness Studio giving you my spinal tip of the week. So what we've done is I'm going to take you back, and this is going to be like our greatest hits so far here kind of episode. We shot this video with Lindsay Allan, who's an occupational therapist right here in the Kamloops area, and she goes through how to set your car up for success. So check it out. I hope you learned something and you start applying what you learned from the video there. You get your car set up for success. Hey everybody, it's Dr. Rob Conroy here from Inspire Chiropractic and Wellness Studio. I'm here with Lindsay Allan, occupational therapist. Lindsay and I have been friends for a long time, and I'll tell you what, we're sitting here discussing ergonomics as it related to desk space more so, and then we started talking about setting up your car for success. Now, a lot of people, when we look at it, we're saying to a lot of patients, they're driving to the coast and back all the time. They're in their car 4, sometimes 5, 6 hours. And by the time they get to the coast, they're literally bled. They get out of the car and they feel stiff, they feel achy. And really at the end of the day, their ergonomics for their car setup is just sitting in their blind spot. So what we're gonna do today is we're really gonna shed some light on how to set your car up for success.
Yeah, absolutely. To start off, we're gonna keep it simple, and I'm gonna show you how to get into the vehicle. Usually you would get in swinging your hip open. You want to prevent that torsion in the spine and hips by simply putting your bum on the seat and swiveling both legs in at the same time so that your pelvis is sitting back into the seat and your hips are facing directly forward. You're going to want to have your hips and your knees both at 90 degrees, so 90 and 90. And this will have your pelvis back into the seat so that you are at an upright position with your ears on top of your shoulders stacked on top of your hips. So now we're going to talk about the headrest. This is something you should actually be using. You'll notice that the apex, or the part that sticks out the most, is in line with the top of my ears. Proper positioning of the headrest is not only comfortable for your trip, it will protect you in the event of a motor vehicle collision. So now we're going to talk about the position of your steering wheel. You will find usually the adjustment for the steering column on the bottom of the steering column. A great rule of thumb is to hold your arm out in front of you. You don't want that steering wheel to be any further than your wrist crease away. Now we're also going to look at the position of this airbag. Ideally, you want it to be positioned towards a larger part of your body, so your chest instead of your face. Should it ever deploy, you're going to have less damage if it hits you in this area than it does in this area, which can cause damage to your face and cervical spine. So go ahead and adjust that. And when you have it right, make sure you can still see your instrument panel through the steering wheel, and then lock it in place. And you're all set. And as you can see, it's just that easy. Of course, if you'd like to make any additional adjustments to your vehicle, I would always recommend that you refer to your owner's manual because every car is different.
That's it. And so thanks again for your time, Lindsay, because that was great. And the strategies are simple, they're effective. If you set your car up like this, just like Lindsay had talked about, not only is your car rides going to be safer, they're going to be more enjoyable for you and your entire family.